welcome. Today, we're diving into congestive heart failure. Now, that name sounds pretty intense, and, well, it is. But here's the thing, it's not really a single disease. Think of it more like the end of the road, the final common pathway for a whole lot of other heart problems. So, let's break down what that really means.
All right, here's our game plan. We'll kick things off with the absolute basics. What exactly is heart failure, and how's a healthy heart supposed to work? From there, we'll get into why the pump starts to weaken, what warning signs to look out for, and finally, how the condition is managed.
So let's get right into it. What is heart failure? Let's get to the absolute core of the problem. Just look at the difference here. The contrast is, wow. On the left, you've got a healthy, normal heart, and on the right, a heart in failure. You can see right away how that ventricle is enlarged. It's stretched out. This isn't some small adjustment. The whole structure of the heart has changed, and that's where all the trouble begins. Okay, so if we're going to get technical for a second, here's the clinical definition. It basically means the heart just can't pump enough blood to keep up with what the body needs to function, to get oxygen and nutrients to all the cells. And pay close attention to that word congestive. It's super important because it points to the backup of fluid that starts to happen, which leads to congestion in the lungs and other parts of the body. To really get a handle on what's going wrong, we first have to understand what right looks like. So let's take a quick look at how the heart's incredible pumping power is supposed to work. There's one number that is absolutely key to this whole conversation, the ejection fraction, or EF for short. It's really just the percentage of blood that the heart's main pumping chamber pushes out with every single beat. In a healthy heart, that number is somewhere between 55 and 70%. This number becomes a critical benchmark when diagnosing and tracking heart failure. Now, this slide helps break down two other key ideas, preload and afterload. Preload is basically the stretch on the heart muscle just before it squeezes. Think of it as preparing to pump. Afterload, on the other hand, is the resistance or pressure the heart has to pump against to get the blood out. For everything to run smoothly, these two forces have to be in a delicate balance. Now, it's important to know that heart failure isn't a one-size-fits-all condition. On one side, you have what's called HFrEF, or heart failure with a reduced ejection fraction. The easiest way to think about this is a weak pump. The muscle just can't squeeze effectively anymore. But on the other side, you have HFpEF, where the ejection fraction is preserved. Here, the pump can still squeeze just fine, but the problem is the muscle has become stiff and thick, so it can't relax and fill up with enough blood in the first place. It's a filling problem, not a squeezing problem. So that begs the question, how does a pump that's designed to beat billions of times start to weaken? What kicks off this process, and what are the downstream consequences for the entire body? Well, there are a few usual suspects. The number one cause is coronary artery disease, which can starve the heart muscle of oxygen and lead to a heart attack. But right behind it is long-standing high blood pressure. I mean, think about it. That's like forcing your heart to work against heavy resistance day in and day out for years. Other culprits can be things like faulty heart valves, chronic irregular heartbeats, or diseases of the heart muscle itself. Okay, this is where things get really interesting and kind of paradoxical. The body's smart. It senses the heart is struggling, so it tries to help. It activates all these alarm systems, flooding the body with hormones to make the heart beat faster and harder. And it tells the kidneys to hang on to salt and water to boost blood pressure. In the short term, this works. It's a lifesaver. But over the long term, this constant state of emergency puts an incredible strain on the already failing heart, creating a vicious cycle that just makes the failure worse. So that's all the biology happening on the inside. But what does someone with heart failure actually feel or experience? Let's take a look at the warning signs we need to recognize. A really important distinction here is whether the left side or the right side of the heart is failing first. When the left side fails, blood and fluid back up into the lungs. That's pulmonary congestion. The classic symptom? Breathlessness. When the right side fails, the backup happens in the rest of the body's veins. That's systemic congestion, and the signs are things like swollen feet and ankles, or even an enlarged liver. This image tells such a powerful story. This is a classic sign of left-sided failure called orthopnea. When a person lies flat, all the fluid that might have been settled in their legs rushes back towards their chest, essentially flooding their lungs and making it incredibly hard to breathe. It's why many people with heart failure have to sleep propped up on a bunch of pillows, just like this. And this right here is one of the telltale signs of right-sided failure. It's called pitting pedal edema. That fluid backup from the systemic congestion pools in the lowest parts of the body, like the feet and ankles. When you press a finger into the swollen area, it leaves a little indent, a pit, that takes a few moments to fill back in. Okay, so we've seen the causes and the signs. How do we actually diagnose heart failure? And most importantly, what can we do to manage the condition and help people live better, fuller lives? The absolute gold standard test is an echocardiogram. It's basically an ultrasound of the heart. It lets us see the heart in action, measure that ejection fraction we talked about, and check for any structural issues. A simple blood test for a hormone called BNP is also a huge help because its levels shoot up when the heart's ventricles are being stretched. Then you have things like a chest x-ray and an ECG to add more pieces to the puzzle. Treating heart failure is a multi-pronged attack. It's not just one magic pill. First, you start with diuretics or water pills to help get rid of all that excess fluid and relieve the congestion. But the true game changers are the drugs that block that harmful over-response from the body we talked about earlier. Medications like ACE inhibitors and beta blockers basically protect the heart from that constant strain. And now we have even newer classes of drugs that are showing incredible results in helping people live longer. But I have to say, medication is only half the battle. Lifestyle changes are absolutely 100% critical. Remember how the body is trying to hold on to salt and water? Well, that means one of the most powerful things a patient can do is cut way back on their sodium intake. It might sound simple, but it makes a huge difference in managing symptoms. So, let's tie this all together. Picture this, a 65-year-old man. He's got a history of high blood pressure and had a heart attack a few years back. He comes in because he's getting more and more breathless and his ankles are swollen. When we put all the puzzle pieces together, his history, his symptoms, and his tests, the diagnosis is clear. Heart failure with a reduced ejection fraction of just 30%. It's a textbook case of how all these factors come together. Ultimately, after everything we've talked about, the best treatment is without a doubt prevention. The biggest takeaway here is to aggressively manage all the things that can lead to heart failure in the first place. That means getting blood pressure under control, treating artery disease, managing diabetes, and of course, quitting smoking. Regular checkups are key to catching things early. And that really leaves us with a final massive question. We know that conditions like high blood pressure and heart disease are on the rise. So what can we do as a society to turn the tide and prevent the heart failure of tomorrow? That's something for all of us to really think about. Thanks for joining this explainer.